I was going about my life, middle-aged, very ordinary life, and suddenly my life had totally changed direction.
I went for a routine blood test, and during the blood test, they found an anomaly in my blood.
And then suddenly I was a patient. Like overnight I was a patient in an acute care ward, and my life crumbled.
When our brother was in ICU, the greatest fear was whether he could not just survive, but what kind of life he would have. What would his abilities be?
We see this every day for patients who come here. Their lives were irrevocably changed by the very events that brought them to hospital.
Life changes. A stroke, diabetes, heart disease, or cancer can change our lives in ways it's difficult to imagine. Change can happen at any time. It can happen in an instant. That's where we come in.
What we do is help patients make sense of what happened to them, and not only help them get better, but to give them a good sense of what their potential will be at the end of the day, and give them tools to reach that potential.
We bring together disciplines from across all areas of medicine, nursing, and rehabilitation therapies. We focus on trying to get a full picture of what is going on with this patient.
I found myself suffering in an emotional sense, in a very unexpected way. Bridgepoint were able to react to that, able to assist me, advise me, counsel me, and offer me services that I didn't realise were part of the deal in coming here.
They understand without having to have a lot of explanation, and they see the issues that I present as puzzles, not as problems, and they seek solutions that we work on together.
Bridgepoint has certain medical services that my brother needs, but beyond that, it's the staff that really make the difference. The staff in therapy that get him out of bed and doing things all day long so that he eventually became the way he is, which is pretty much his old self.
We do move people forward. We do get people back to the community. This is what makes Bridgepoint different. This is what makes Bridgepoint a leader in complex care and rehab.
We're the only hospital in the country that is really focused from a clinical care, research, and teaching perspective on dealing with complex chronic illness. There's not another research enterprise like that in Canada or, in fact, around the world. We're building a state-of-the-art building here that does have the tools and technology that support dealing with very complicated patients.
I think that with those upgraded facilities and new technology and everything, it's going to be absolutely amazing and so helpful for the patients that are here.
The setup of this building is going to be fantastic for patients. They are going to really be inspired in these spaces. We're really looking forward to that.
None of us know what may happen today, tomorrow, next Tuesday.
Probably one of the most humbling things about being in this role is that you know that everyone will have a vulnerability.
Bridgepoint has rebuilt my life so that I do feel like I'm a whole person now.
They've been able to help my brother adapt to the fact that his life has changed.
Without Bridgepoint, I don't believe that I would have recovered as well, as fast, and as fully as I have.
Bridgepoint gave me my life back.
Help us change lives. Learn more at lifechanges.ca.